welcome everybody and good afternoon. It's a beautiful spring day, so I'm appreciative that you're here with us today as we talk about a topic that's really near and dear to my heart, which is the cancer and cancer treatment related cognitive changes that I know many of you may have experienced, as may have your loved ones. So as Judy mentioned, we're going to divide things up into three sections today and take some questions in between. She'll be pausing the recording, I think, periodically as well. So we'll be talking today about what this phenomenon is and why we believe it happens. We'll spend some time talking about common strategies that people have found to be effective and what the research currently is showing. And then we'll end up in session 3 with some of the current research and future research that we have planned. So without further ado, we'll jump right in. What do we think this phenomenon is and why do we believe it happens? And I just want to encourage everybody to say that this is very much on the international and national radar for individuals who are in the healthcare field. There is an organization called the International Cognition and Cancer Task Force, which meets every other year. Things have changed a little bit with COVID, but this is a group of international researchers who are all passionate about solving this problem. And I'm also very excited to say that the Oncology Nursing Society, which is the organization that I am most involved with, considers this a research priority. I mean, we gave a panel presentation last year that was very well received. And the American Society of Clinical Oncologists, which is an international group as well, considers this to be a research priority. And we got to present at their meeting last year as well. So know that we're making progress. Whereas a few years ago, when I gave this type of talk, we were still struggling to get healthcare professionals to recognize this as an issue that needed to be addressed. So we can call this any number of different things, but chemobrain is probably the most popular term, if you will, because chemotherapy is one of the culprits that can cause the cognitive issues related with cancer and cancer treatment. But it's a little bit of a misnomer because it's not just chemotherapy that causes the issue. We know that the cancer itself causes a reaction within the body that can have an impact on the brain. We know that suppressing estrogen for breast cancer and suppressing testosterone for prostate cancer has an impact on cognitive function. And we're investigating as we speak what kind of an impact the newer targeted immunotherapy agents may have. So chemobrain is a popular term, but maybe not fully descriptive. What we're talking about here is relatively mild cognitive issues that we attribute to cancers that are not starting in the brain or central nervous system, because that's a little bit of a different animal. But what people describe most commonly is feeling forgetful, not being able to focus or concentrate. The most common concern that people report is issues finding the right word. You know, just it's on the tip of your tongue and you just can't pull it out of the file cabinet to use in conversation, which is a pretty frustrating thing to have happen. People describe losing things easily and really struggling with doing more than one thing at a time, or multitasking, where that might actually have been someone's area of strength before the cancer diagnosis. It's now much more of a struggle. And for some folks, even driving to places they're very familiar with might be challenging. The cognitive domains that are most commonly affected would be short-term memory, processing speed, and something called executive function, which is a lot about being able to get from point A to point Z by accomplishing all of the various steps that might require. But it's also the ability to switch back and forth between tasks. These are 3 of the most challenging areas for people. The time frame is really variable about when a person notices that something's different. If we talk just about chemotherapy for a second, somewhere within the first 3 cycles is pretty common for a person to notice changes. However, there are a large group of people that don't notice something's different till chemotherapy is completely over and the dust begins to settle. They try to get back to their regular patterns. And then they realize, oh, wow, something's different. Things are a lot more difficult than they were before I went through that treatment. And recovery time also is variable. 1 to 2 years after having completed therapy is a general rule of thumb where people begin to notice improvement. But there's a small group of folks that have more significant issues or issues that might last longer. And we're still trying to figure out what is different about that group. And if we can figure that out, we might be able to prevent it from happening and protect people from having to experience these challenging side effects. The consequences on people's quality of life can be pretty significant, though, in terms of work, being able to juggle the responsibilities of work at home, and then socially, as particularly if the word finding issue creeps in and people might choose not to go to a function because of that frustration that they're feeling about not being able to have a conversation like they'd like to. So that can be somewhat isolating for people, but really, really common experience for people. It's estimated that up to 75 to 95% of people that are diagnosed with a cancer at some point during the journey experience some type of issues along these lines. But pretty difficult to study because there's so many confounding and contributing factors. Part of which is there's a disconnect between the tools that we have to assess cognitive function and what people actually experience themselves, where many people will perform perfectly normally on what would be considered a standard neurocognitive test, because those tests really weren't designed for this. They were designed for dementia or head injury or stroke, things of that nature. May not be the best tools. And may not be sensitive to the more subtle differences that people experience after having been through cancer treatment. The other thing that can complicate this is a lot of people will have some changes even before treatment, because as I mentioned, the cancer itself can cause some cognitive issues. So that complicates the picture. When is baseline? And you may not be able to catch somebody at baseline because they don't even know that they have their malignancy yet. And here's a laundry list of other things that can muddy the water. Obviously, we know as we age, cognitive function changes, so that can contribute. I mentioned the fact that suppressing estrogen or testosterone can have an impact, and part of that happens normally with aging, but then we make it more pronounced by the cancer therapies that we give. People start out at various baselines. We're all a little different in terms of what we're bringing to the table cognitively. There may be certain genetic changes that would predispose a person to have more issues than someone else related to cancer and cancer treatment. And then on the right-hand side of the slide, all of these things that go along with cancer and cancer therapy can exacerbate the issues with cognitive function, like depression, like anxiety, like fatigue, the type of chemotherapy that someone received, whether or not they're on pain meds. And we'll talk a little bit about the fact that even our diet might have a role to play. So there are a number of different hypotheses about why this happens. You know, we talked a little bit about genes and we talked a little bit about hormones already. One hypothesis would say that maybe cancer and cancer treatment accelerates cognitive aging. Another postulate is that the chemotherapy drugs specifically get past the blood-brain barrier in more volume than was first thought. It can actually cause some damage to some of the cells in the brain. But where a lot of the research is focused right now is over on the right-hand side of this slide. When your body responds to a cancer, when your body responds to cancer treatment, it really reacts a lot like it would if you had an infection. It mounts an inflammatory response against those insults. And that inflammatory response causes a lot of products to get dumped into the bloodstream and also into the central nervous system called cytokines. And those cytokines, we know, can have an impact on people's cognitive function. We really, as I mentioned, it took quite a bit of time for this to get on healthcare professionals' radar screen. And one of the things that really helped that happen was people began to do research with imaging. And magnetic resonance imaging or functional imaging demonstrated that there were actual structural changes in the brain and there were actual functional changes in the brain that could explain what people were reporting that the healthcare team maybe wasn't really embracing. So we're very thankful to people like Doctors McDonald and Holohan for putting this research out there where it could be disseminated. And many of you have probably seen this slide that sort of is a good demonstration of that. The images here are for two identical twin sisters, 60 years old. The woman across the top, letter A, is the woman who'd been through breast cancer and breast cancer treatment. The woman on the bottom labeled B is her twin sister. Both of the women were given cognitive tasks to do. They got progressively more difficult while they were in the MRI machine. And the MRI results would show that, well, actually, I'll take that back. The results of the cognitive tests that these two women did were fine. Both women performed just fine on the neurocognitive tests that got more and more difficult. But the imaging showed that the woman on the top who'd been through breast cancer treatment was working a lot harder to accomplish the task that she and her sister both performed. And so this really was like the aha moment, like, wow, cognitive effort. They're expending a lot more cognitive effort after having been through cancer and cancer treatment than someone who had not been through cancer therapy. So that kind of brings us to the end of segment one, which is why do we think this happens? So as Judy mentioned, we'll take a few questions now before we shift into segment two.
You can either jump in verbally and ask your question, or you can type it in the chat. And while I wait for you to do that, I have a question for Jamie. Jamie, you mentioned that a significant percentage, I think it was 30 to 75% of cancer patients report cognitive changes before treatment. And I'm wondering, are there gender differences that for the pre-cancer diagnosis cognitive changes, and do those vary by age, or are there other markers?
Excellent question, Judy, and complicated question. To my knowledge, without kind of going back and digging into the literature a little bit, I don't think that gender disparity has been well assessed for the folks that it's happening to ahead of time. What I can tell you is the types of malignancy that those studies have been done in would reflect breast cancer, colorectal cancer, lung cancer, some of the hematologic malignancies, and I believe there's also been a study done in testicular cancer. So both genders have been represented, but the studies weren't done in such a way where the genders were compared head to head, to my knowledge. Did I answer the whole question, or did I miss part of it?
Nope, you got it. Thank you.
Okay.
If anybody has additional questions, you can either go ahead and ask them, or type it in the chat.
I have a question. Can you hear me?
Yes, go ahead, Barb.
So for me, this is a puzzle because it's been since 2019 that I completed treatment. And then we went into COVID, into all of that. And so the result, you know, I still struggle with this perhaps Chemobrain, but I mean, it's hard to know how to assess and you know, whether to seek treatment or whatever. Can you speak to that?
As far as how you would determine if you were having issues from the cancer specifically, and then whether or not you should seek intervention?
Right. Well, I'm thinking in terms of, do I just blame this on chemo, the brain fog and the, you know, and of course I have birthdays every year too. I mean, it's hard to know. It's hard to know. Is this just something we live with? You know, you said that a lot of people get over this chemo brain fog stuff.
Time does indeed help. So one of the things I think that might help answer your question as we shift into the second segment today, I'm going to talk to you about some things that are evidence-based, which people have found to be helpful. And so this would be a variety of strategies that you consider maybe employing in your own daily life. And then we'll end up at the third section. I'll tell you about some research that's going on right now. There's one study in particular that you might be interested in based on what you just told me. So stay tuned.
Okay.
Okay.